Why is anorexia recovery so difficult? Have you ever wondered why recovering from anorexia is such a tough journey? Anorexia nervosa is a serious eating disorder that involves an intense fear of gaining weight, a distorted body image, and severe restriction of food intake. Recovery is complex and challenging for many reasons that touch on medical, psychological, and social aspects. First, anorexia impacts both the mind and the body. It often starts with psychological issues like anxiety or low self-esteem. However, as the disorder progresses, malnutrition leads to serious physical health problems. These can include heart issues, bone loss, and hormonal imbalances. Malnutrition can also cloud judgment and make it hard to feel motivated to recover. Next, anorexia is closely tied to a person's sense of identity and control. Many people with anorexia use their eating behaviors to cope with stress or overwhelming feelings. Letting go of these behaviors can feel like losing an essential part of themselves, making recovery seem frightening. Another challenge is the distorted body image that often accompanies anorexia. Many individuals may not see how serious their condition is. Even when they are underweight, they might perceive themselves as overweight or not sick enough to seek help. This lack of insight can delay treatment and hinder recovery efforts. Furthermore, recovery involves facing difficult emotions and underlying psychological issues. Therapy for anorexia typically goes beyond just eating habits. It addresses the thoughts and feelings that drive those behaviors, which can be an emotionally painful process. Social and environmental factors also play a significant role in recovery. Family dynamics, peer pressure, and societal views on body image can all influence the development and persistence of anorexia. If a person's environment does not support healthy changes, recovery can become even more challenging. Relapse is another common hurdle in anorexia recovery. Even after making significant progress, individuals may face setbacks due to stress or triggers from their past. Experiencing a relapse does not mean failure. It highlights the chronic nature of the disorder and the need for ongoing support. Lastly, effective treatment for anorexia requires a multidisciplinary approach. This includes medical monitoring, nutritional counseling, and psychological therapy. Recovery is not just about gaining weight. It involves rebuilding a healthy relationship with food, body, and self. This comprehensive process takes time and patience, and progress can be slow and nonlinear. In summary, recovering from anorexia is difficult because it requires addressing complex interactions between physical health, mental health, identity, and environment. While the journey is challenging, it is possible with the right support and professional treatment. If you or someone you know is struggling with anorexia, seeking help from qualified healthcare professionals is crucial for personalized care and support throughout the recovery process.